Welcome to the OVA vlog. This is part 2 of our 3-part series on reproductive cancers in women. And this edition we're talking specifically about cervical cancer, and we are joined by Dr. Song, who focuses on women's reproductive cancers, and Erica, who's studying ovarian cancer here at the University of Minnesota as a PhD student. Welcome.
Thank you.
What is cervical cancer?
So cervical cancer starts in the cervix, which is the lower part of the uterus. So when you have, so it's at the bottom part of the womb, I guess you should say.
Yeah. So what are some of the symptoms involved with cervical cancer?
So again, people who come in with early cervical cancer or pre-invasive cervical cancer can come in with no symptoms. They may not even know it. So that's why pap smears are very important to detect very early cancers or pre-invasive disease. But people who come in with symptoms are those who have a little bit bigger tumors that may have grown into other organs. So they could come in again with abnormal bleeding, pain during intercourse, and some abnormal discharge that they are not used to.
So in thinking about, we hear a lot about cervical cancer because it's one of the ones that we can screen for, but how common is it?
So about 13,000 women are diagnosed with cervical cancer in the United States every year.
Okay, 13,000 in the U.S. Okay, every year. And what are some of the ways that we screen for it?
Yeah, so we kind of talked about that a little bit. Yeah. So the pap smear, it used to be annually that women would go in and get their pap smear, but now I think they changed that to every 3 years if you're not at risk, meaning like you don't have HPV or you have had an abnormal pap in the past. So for most normal women, it's every 3 years now. You go in and get that checked out and tested for. So yeah, it's really lucky that in cervical cancer we have that screening method, because I know in ovarian cancer we don't have that, which we'll talk about a little later.
Yeah. And so are there advancements right now with cervical cancer?
Yeah, there have been a few. So typically like with the other gynecologic cancers, we have surgery, radiation, and chemotherapy that people with cervical cancer can have, and it depends on the severity, of course, of the course of the disease. But so HPV vaccine or Gardasil, that's been a major advancement in helping to decrease the incidence of cervical cancer. And then Avastin is actually a new drug that was recently FDA approved for cervical cancer, and it actually stops the formation of blood vessels.
Oh,
so
in the cancer?
Yep, in the cancer, yep. Mm-hmm. So that's been a new therapy that's been approved.
Okay. So definitely if you have daughters, young daughters, and sons at this point too.
Yep. They all should be vaccinated.
Yeah, just vaccinate them. Get them the Gardasil vaccine to prevent HPV, which is the leading cause of cervical cancer. Awesome. Well, thank you so much for joining us, and stay tuned for our next episode, which will be all on ovarian cancer.